Now I will deal with an inferior or basal view of the skull, norma basalis, and we can see the bones that form the base of the skull. Some of them form the cranium. These are the bones that form the cranium, lower part of the cranium. This is the yellow one, is the sphenoid bone, and this is the temporal bone and the occipital bone. So the occipital, temporal, and sphenoid bone, they form the base of the skull behind the bones of the face, and the bones of the face here include the maxilla. This is part of the maxilla, and this is the part of the palatine bone. The biggest foramen here is foramen magnum. There are multiple foramina on the base of the skull, but the biggest foramen is the foramen magnum. And the foramen magnum here is oval in shape. Its long axis is anteroposterior, and horizontally the width of the foramen magnum is almost the width of this opening here, which is the opening between the medial pterygoid plates. This is the opening, posterior opening of the nasal cavity. It has almost the same width of that opening. Foramen magnum here is bounded anterolaterally by these condyles, and these are called the occipital condyles, and they provide an articular surface with the lateral mass of the atlas at the atlanto-occipital joint. The atlanto-occipital joint allows some abduction and some flexion extension or bending and anteroposterior bending, but it does not allow rotation. Rotation here is only allowed at the pivot atlanto-axial joint, but not at the atlanto-occipital joint. The occipital bone behind foramen magnum shows the external occipital protuberance here, and on either side of the external occipital protuberance is the superior nuchal line. Between the external occipital protuberance and foramen magnum, there is a crest of bone, which is called the external occipital crest. And parallel and concentric with the superior nuchal line, there is another faint line here, midway between the external occipital protuberance and the foramen magnum. This line is the inferior nuchal line. So superior nuchal line, inferior nuchal line, concentric with each other and with foramen magnum. And external occipital crest, there is another crest here, very faint laterally. And so these lines, they will divide this region of the occipital bone into 4 areas for the attachment of the muscles at the occipital region, in the suboccipital region of the neck. These are, you can see this is the area here is rough because it provides for the attachment of muscles. This is the Petrous part of the temporal bone, and it is wedged in between the sphenoid bone and the occipital bone. Between the Petrous part of the temporal bone and the occipital bone, there are notches. So the notches between the Petrous part of the temporal bone and the occipital bone, they form a foramen, boundaries of a foramen, which is the jugular foramen. This is the jugular foramen. Jugular foramen, we can see it also on the inside of the skull here. It opens into the posterior cranial fossa, and the jugular foramen, it transmits the jugular bulb. The jugular bulb is the upward enlargement of the internal jugular vein. In addition to the internal jugular vein and its bulb, there are cranial nerves that pass through this foramen, and these are the 9th, 10th, and 11th cranial nerve, the glossopharyngeal, vagus, and accessory nerves. They pass through the jugular foramen. In front of the jugular foramen is another foramen, which is called the carotid canal, This transmits the internal carotid artery. The internal carotid artery passes through the carotid canal upwards, and then it changes its direction within the petrous part of the temporal bone and passes medially and forwards within the petrous part of the temporal bone. We cannot see it here. Okay? And then, as it reaches the tip of the petrous temporal bone, this is the region of the tip of the petrous temporal bone, we can see here that there is a foramen. This foramen has lacerated margins, and so the foramen is called foramen lacerum. So the internal carotid artery in its horizontal course within the petrous temporal bone appears at above the foramen lacerum, above it. Does not pass through it, but appears above foramen lacerum, and then it goes upwards into the middle cranial fossa. This is the styloid process. Styloid process is part of the temporal bone, and the styloid process provides for the attachment of stylomuscles, 3 stylomuscles, and a ligament. The stylomuscles are the stylohyoid, styloglossus, and the stylopharyngeus. These 3 muscles have a common origin from the styloid process and different destinations, and each of these 3 muscles is supplied by a separate nerve. The stylopharyngeus is supplied by the glossopharyngeal 9th cranial nerve. In fact, it's the only muscle that is supplied by this nerve. The styloglossus is supplied by the nerve of the muscles of the tongue, and it's supplied by the hypoglossal nerve. And the stylohyoid is supplied by the facial nerve. This is the mastoid process here. It's part of the temporal bone, downward prolongation of the petrous part of the temporal bone. And medially here, there is a notch in the mastoid process which provides for the attachment of the posterior belly of digastric muscle. So this is the digastric notch. Medial to the digastric notch, there is a groove, and this groove is for the occipital artery. Between the mastoid process and the styloid process, there is another foramen, this foramen here. So the foramen is called the stylomastoid foramen, between the styloid and mastoid processes. This stylomastoid foramen transmits the facial nerve. The facial nerve, as it appears from the stylomastoid foramen, it will provide a branch that supplies the nearby posterior belly of digastric muscle, which is attached at this groove, as well as the stylohyoid muscle, which is attached at the styloid process. Here we have the glenoid fossa or mandibular fossa, and this is for the articulation with the head of the mandible, the mandibular condyle. At the joint here is a synovial joint, the temporomandibular joint. In front of the glenoid fossa, there is an eminence, articular eminence, and this articular eminence in life, it is covered by cartilage and provides also for the provides an articular surface for the temporomandibular joint. In front of the articular eminence, this area here, the thumbprint area, is called the infratemporal fossa. The infratemporal fossa is formed by 2 bones. It's formed by the greater wing of the sphenoid and part of the temporal bone. Here in this colored skull, we can see the region of the infratemporal fossa, thumbprint area, is formed of 2 bones, the temporal bone and the greater wing of the sphenoid bone. Between the infratemporal fossa and the temporal fossa can be seen on the lateral view of the skull, the infratemporal fossa on the inferior view of the skull. In between, the boundary in between them is a crest of bone, which is called the infratemporal crest, separates between the temporal and infratemporal fossa. Here is another part of the sphenoid bone. This is called the spine of the sphenoid. The spine of the sphenoid provides for the attachment of the sphenomandibular ligament. And in front of the spine of the sphenoid, there is a small foramen, which is called foramen spinosum. So foramen spinosum is called so because of its relation to the spine of the sphenoid bone. And in front of the foramen spinosum, and anteromedial to it, is another foramen, which is oval in shape, and it's called foramen ovale. Both these foramina are located within the sphenoid bone, within the greater wing of the sphenoid bone that forms part of the infratemporal fossa and continues on the lateral side of the skull to form part of the temporal fossa. Foramen spinosum provides for the passage of the middle meningeal artery. And foramen ovale is the main constituent, the main structure that passes through foramen ovale is the mandibular division of the trigeminal nerve. So the mandibular division of the trigeminal nerve, as it passes from the middle cranial fossa through foramen ovale, it will find itself in the infratemporal region of the head. There are other structures apart from the mandibular nerve that pass through foramen ovale, like the accessory middle meningeal artery and the lesser petrosal nerve. The lesser petrosal nerve carries the preganglionic parasympathetic fibers for the otic ganglion. It arises from the tympanic plexus and carries these preganglionic fibers to the otic ganglion, whose postganglionic fibers will supply the parotid gland. Also, some veins, emissary veins, may pass through foramen ovale that communicate between the cavernous sinus and a venous plexus, the pterygoid venous plexus, which is located outside the skull. But again, as I mentioned, the main structure that passes through foramen ovale is the mandibular division of the trigeminal nerve. Sometimes these emissary veins may pass through accessory foramina, which are sometimes located here and are called the foramen of Vesalius. Again, the foramen here is foramen lacerum, and this foramen, although it looks like a big foramen, but it does not transmit anything of importance. In life, it is covered by fibrous tissue and only transmits some emissary veins. Let's go a little bit backwards to mention something about another foramen, which is located superior to the occipital condyle. This is the foramen here. And this is the called the hypoglossal canal. The hypoglossal canal transmits the hypoglossal nerve, the 12th cranial nerve that supplies almost all the muscles of the tongue. Behind the occipital condyle, there is a fossa, condylar fossa, and sometimes this fossa is perforated by a posterior condylar canal. Here it is not perforated. In this model, you can see the condylar fossa behind the occipital condyle, and you can see here the perforation, the posterior condylar canal. The posterior condylar canal transmits emissary veins from the sigmoid sinus inside the skull and the veins in the suboccipital region outside the skull. In this model, I'm going to go rapidly through the foramina that we have just described. This is part of foramen magnum. This is the occipital condyle, and behind it is the condylar fossa, which does not show a foramen because the foramen is not always present. These emissary veins are not always present. Here we have the jugular foramen. It's rather a big foramen here. And between the styloid and mastoid processes is the stylomastoid foramen. In front of the jugular foramen is the carotid canal. So this is the carotid canal. And at the tip of the Petrous temporal bone is the foramen lacerum here. And this is the spine of the sphenoid bone. In front of it is the foramen spinosum, and anteromedial to foramen spinosum is the foramen ovale. The spine of the sphenoid here, it overlies an opening which is located horizontally here, and this is the opening of the bony part of the auditory tube. The auditory tube is partly bony, partly cartilaginous, communicates between the middle ear cavity and the nasopharynx. And here, the groove here between the sphenoid bone and the petrous part of the temporal bone, it lodges the cartilaginous part of the auditory tube, which is the continuation of the bony part of the auditory tube. The cartilaginous part of the auditory tube lies horizontally here, like this, and its tip opens at the nasopharynx. The opening here, the big opening here, is the posterior nasal aperture, and in the midline you can see the nasal septum. The nasal septum here is formed by the vomer. So behind the nose, the area here is the nasopharynx, and the auditory tube, the cartilaginous part of the auditory tube, opens on the lateral side of the nasopharynx. This bone here forms the roof of the nasopharynx, and it's called the basi-occiput. The basi-occiput, it unites with the basi-sphenoid, the basal part of the sphenoid, part of the body of the sphenoid bone. And in the middle of the basi-occiput, there is a small tubercle. It's not very clear in this model. It's called the pharyngeal tubercle. Provides for the attachment of a midline raphe of the pharyngeal constrictors muscles. So this region here is related to the nasopharynx behind the nose. Here again you can see the basi-occiput and basi-sphenoid. They are uniting together. Actually, the joint between them, usually it calcifies by synchondrosis at about 25 years of age, and they is located at the roof of the nasopharynx. This is the vomer at the nasal septum, the vomer, and it has processes from the lateral side, which are called the vaginal processes, articulating with the medial pterygoid plates. These are the medial pterygoid plates, part of the sphenoid bone. The sphenoid bone has a body, it has pterygoid plates, medial and lateral pterygoid plates, and it has wings. This one is the greater wing of the sphenoid, and the lesser wing of the sphenoid can be seen from the inside of the skull. Between the vomer and its vaginal process and the medial pterygoid plate, there is a canal here, which is called the vomerovaginal canal. This is an important canal because it transmits nothing and is closed actually in life by fibrous tissue. The medial pterygoid plate forms a lateral boundary of the posterior nasal aperture. The medial pterygoid plate is located in the lateral wall of the nose, and inferiorly, this is inferior aspect because we are showing the skull inverted in this view. So this is the inferior part of the medial pterygoid plate. The inferior part of the medial pterygoid plate is projected as the pterygoid hamulus. This is the pterygoid hamulus. And superiorly here, you can see that related to the upper part of the medial pterygoid plate is a fossa, which is called the scaphoid fossa. The scaphoid fossa here provides for the attachment of a muscle of the soft palate, which is called the tensor palati muscle. The tensor palati muscle arises from this fossa, very close to the cartilaginous part of the auditory tube here, and the muscle descends down, and then it will change its direction at the pterygoid hamulus. So the pterygoid hamulus acts like a pulley, where the muscle fibers of the tensor palati will change their direction and will become horizontal, form the palatine aponeurosis here at this position, and this palatine aponeurosis is the skeleton of the soft palate that is attached to the bony hard palate. To reorient you again, this is the medial pterygoid plate with its pterygoid hamulus here. This is the scaphoid fossa, the boat-shaped fossa. That's why it is called the scaphoid fossa. It's located at the base, the upper part of the medial pterygoid plate. And here we have a small tubercle, which is called the pterygoid tubercle. This tubercle, in fact, it projects toward foramen lacerum. This is foramen lacerum at the tip of the Petrous temporal bone. So the pterygoid tubercle projects backwards. Actually, it overlies an opening. I cannot show you this opening here. The opening which is overlaid by the pterygoid tubercle is called the pterygoid canal. And the pterygoid canal transmits a nerve which has the same name, the nerve of the pterygoid canal, or the Vedian nerve. The nerve of the pterygoid canal passes at the upper part of foramen lacerum, passes forwards. It passes, the canal passes forwards. It is a horizontal canal, and it opens at the pterygopalatine fossa, a hidden region of the skull. This nerve of the pterygoid canal is formed by the union of the deep petrosal nerve and the greater petrosal nerve. The deep petrosal nerve carries sympathetic fibers that accompany the internal carotid artery, and the greater petrosal nerve carries parasympathetic fibers that originate from the geno of the facial nerve. Now the mandible is back in its position, and I will show you the extent of the pterygomandibular raphe. It extends from the pterygoid hamulus. This is the pterygoid hamulus at the lower part of the medial pterygoid plate. And the pterygomandibular raphe extends from here toward the mandible here. This on the medial side of the mandible, on the inside of the mandible. Here on the inside of the mandible is this line, which is called the mylohyoid line. At the posterior end of the mylohyoid line is the attachment of the pterygomandibular raphe. Okay? And this pterygomandibular raphe provides for the attachment of the superior constrictor muscle posteriorly, and anteriorly the muscle fibers of buccinator. Here, the muscle fibers of buccinator extend anteriorly from the pterygomandibular raphe. The posterior edge of the medial pterygoid plate provides for the attachment of the buccopharyngeal fascia, and forms part of the wall of the pharynx, nasopharynx. The lateral pterygoid plate, this flange of bone, provides for muscle attachment. And the lateral pterygoid plate on its lateral side, it provides for the attachment of the lateral pterygoid muscle. Lateral pterygoid muscle has two heads. It has a superior head, which is attached here to the infratemporal surface of the greater wing of the sphenoid, and it has an inferior head which is attached to the lateral part of the lateral pterygoid plate. The medial pterygoid muscle is also attached to the lateral pterygoid plate, so it's not attached to the medial pterygoid plate. Medial pterygoid muscle is attached to the medial side of the lateral pterygoid. The medial pterygoid muscle has two heads. The larger is the deep head. So the deep head of the medial pterygoid muscle is attached here, and the superficial head is attached to the maxilla, to the tuberosity of the maxilla, which is located behind the third molar tooth. The medial and lateral pterygoid muscles are muscles of mastication. The hard palate is made by the palatine process of the maxilla and the horizontal plate of the palatine bone. The palatine bone is, in fact, it has two plates of bone. It has a horizontal plate and a perpendicular plate of the palatine bone. The perpendicular plate of the palatine bone is located in the lateral wall of the nose, and the horizontal plate of the palatine bone forms part of the hard palate. The depth here is produced because of the projection, the downward projection of the maxilla, and this is called the alveolar process of the maxilla. It's called alveolar process because it holds the sockets of the teeth, the maxillary teeth. Here again you can see the alveolar process of the maxilla with the teeth, the maxillary teeth, and this is the palatine process of the maxilla and the horizontal plates of the palatine bone. These plates are projected posteriorly as the posterior nasal spine. And this is the tuberosity of the maxilla, the prominent part of the bone that is located behind the third molar tooth. We can see also some of the foramina here. This is the greater palatine foramen, and there are a group of foramina, very small foramina, and this is only one of them is shown here. It's called the lesser palatine foramen. So a greater palatine foramen and a group of lesser palatine foramina. The greater palatine foramen and the lesser palatine foramina, they transmit nerves and vessels of the same name. These nerves and vessels are branches of the maxillary artery and the maxillary nerve, and these foramina, they communicate superiorly with the pterygopalatine fossa. Anteriorly, in the midline, there is another foramen, which is called the incisive foramen. And this incisive foramen communicates with the nose, with the nasal cavity. And the incisive foramen transmits an artery, a branch, which is an ascending branch of the greater palatine artery. The greater palatine artery supplies the palate and ascends up into the nose, where it anastomoses at the nasal septum with the sphenopalatine artery. The nerve that descends from the nose into the palate is called the nasopalatine nerve. So the nasopalatine nerve and the ascending branch of the greater palatine artery, they pass through the incisive foramen. Now in this section of the skull, I will show you here, this is the incisive foramen, the site of the incisive foramen. It leads, actually the incisive foramen leads into a canal, and this is the incisive canal, and you can see how it communicates with the nose. This is the floor of the nose here. Actually the floor of the nose is the roof of the mouth, and the structures that pass through this canal are an artery, which is the branch of the greater palatine artery, and a nerve, which is the nasopalatine nerve. These are the other foramina here, the greater palatine foramen, the lesser palatine foramina. You can see that the greater palatine foramen is level with the third molar tooth. This is usually it lies level with the third molar tooth. These are the teeth, the third molar, second molar, first molar, and these are the premolar teeth. This is the canine and the two incisive teeth.